Hello, and welcome to the Science on the 7th live stream, a virtual space where we talk about various topics related to air quality and health. I'm your host, Pallavi Pant. Now, a lot of time on this live stream, we've talked about air pollution as a problem, air pollution as an issue that impacts people around the world and can have significant health impacts, can have societal impacts, economic impacts, etc. So, today we wanted to talk a little bit about how people are trying to address the problem, solutions, or ways to lead us to the solutions. And one group of people within that solution space is healthcare providers, the doctors that we all trust will help us figure out what's wrong with our health and get to better health. Now, this community has been engaging with the topic of air pollution increasingly in the last several years. And today we have a phenomenal guest with us who not only has clinical and industry experience and healthcare experience and experience as a physician and a doctor, but also has been serving as a member of the parliament in Bulgaria. I'm very, very pleased to welcome Dr. Alexander Simidchiev. He's joining us from Bulgaria today on a busy, busy day. And Dr. Simidchiev, I'm so happy you could join us and welcome.
Pallavi, it's a real honor and a pleasure to be here and to talk with you and to talk with your audience.
Thank you so much. And for any of you who are listening to us, if you have questions for Alex, please drop them into comments and we'll try to take them towards the end of the live stream. But Alex, this is where I want to start. Very often, when we say air pollution and we try and imagine places where air pollution might be high, most people are probably going to think about Asian countries, India, China, often top of the list for many, but also perhaps African countries. But the Central and Eastern European region is one that also experiences high levels of air pollution. And we've seen, major air quality episodes. I think we have an image, if we can pull that up, of a recent time when air pollution levels were really high in the winter. So can you tell us a little bit about the air pollution situation in Bulgaria and across Southeast Europe and how that's been shaping up in the last few years?
Now, actually, there's two elements to that answer, and I'd like to address both of them. One is the level of pollution, and the other is the actual health effects, because health effects depend on, are you putting a very, very healthy person in polluted environment, or if you're putting a person who is not that healthy in a polluted environment. So ultimately, the end result, the increase in deaths, the increase in chronic non-communicable diseases is a result of both these processes. So if you don't have a really well-functioning healthcare system, you also get major consequences of air pollution, even if it's at the lower level. Now, Central and Eastern Europe traditionally has had higher levels of pollution within the European continent because our energy is being fueled by lots of coal-powered plants. And because a lot of cars, for example, are diesel fuel-powered. So pollution levels are higher than they are in Western Europe, in general. They are sometimes at the level, sometimes lower than they are in Asian countries. But because the healthcare system in many of the Eastern European countries is not as well functioning as the major players in the healthcare arena, the actual effects of the air pollution in Southern and Eastern Europe are disproportionately high.
Yeah, I think you raised such an important point that maybe if we can bring the image back up again, what we had was this, chart, and it's too small for anyone to reach, so please don't bother. But the top line there in red is actually Bulgaria, and we've seen in several global studies that Bulgaria ends up as the place with the highest death rates. So even if the number of deaths aren't the highest. Those always tend to be India, China, because of the population size. We see that if you account for population size and number of people in the country, Bulgaria has a huge death rate. And I'm glad you mentioned the healthcare system because that's, such an important part of this full conversation. And one of the reasons I was really excited to speak with you is because of your work in that space, trying to bring the healthcare sector more actively into the air pollution conversation. And I know a few years ago you founded a nonprofit, Air for Health. And the motto, which I really, really like, is "We care for air." And I would love for you to tell us how that started. What was the motivation for that? I mean, why would a busy clinician and a successful clinician decide to take time and energy and put it into air pollution?
Well, I was at a crossroad in my life when my first grandchildren were born. And with my grandchildren being born, I started thinking, what legacy can I leave them? I mean, ultimately, when we think about air, and I've changed this a little bit from the original Native American Indian saying, but we do not receive the air from our parents, we rent it from our children. So if we want to leave a legacy, it has to be something that will allow them to be at least at the level we are currently in. Have air which is better for breathing than the one we inherited. That way, we can leave a legacy of a cleaner earth, a more sustainable environment, a more sustainable economy, and ultimately happier people. To do that, we need to achieve a lasting impression, a sustainable push towards clean air, clean water, clean land, less climate change. All of these things are some things we can actually invest in so that our children and our grandchildren can live a better life. And in 2017 and 18, somewhere in the middle of there, we decided to join forces with some people that were thinking along the same lines. And we co founded our NGO, which is called Air for Health, with our motto, "We care for air." And actually, it is a group of people in our country that want to make a network of ambassadors, and these ambassadors to be healthcare professionals, to be clinicians. And our most recent organizational approach is to actually start early within medical school and form a network of student medics, which is our student network, Air for Health, which is medical students from currently 3 of our medical universities, soon to be out of 5 of all our 5 medical universities in the country.
That is just fantastic. And I think such an inspirational thing for other places that are thinking about what to do. I think we have a few images of members of your network who are serving as ambassadors, if we can pull them up. And it's been very interesting. I have seen a similar process develop in India also, similar timeline where some doctors decided this was an issue that needed attention and they started putting in a time and effort into this. And slowly we've seen that people start paying attention to those messages. I think it's partly because we all trust our doctors. We know what they're doing. And, we want to get their sort of understanding on this. And you perhaps have a very unique perspective here because, as I mentioned earlier, you have significant clinical experience working at hospitals, at universities, but also in the last couple of years, you have been involved in politics and you're currently a member of the Bulgarian parliament. And interestingly, in many countries, perhaps it is similar in Bulgaria, we see this disconnect sometimes. The health ministries are often very engaged, or at least somewhat engaged, in the discussion on air pollution, and the environment agencies or the agencies that would be responsible for some of the policy making and regulations, perhaps not as much. So, both from your experiences as a medical professional, as a professor, and as a member of the parliament, what are the types of strategies do you think we can use to effectively engage our environment agency and our energy agencies and our development agencies in countries and cities and local municipalities? And what has been that experience like also in Bulgaria for you?
I can share some of the experience, which was quite eye opening for me when I was participating in educational programs for our municipalities, where we were educating the environmental specialists, the ecologists in our municipalities. And I did a talk on the health consequences of air pollution in front of these people. At the end of the talk, almost without anybody asking anything else, they were saying, "Why has this information not been shared with us? Because what you told us about the health consequences, not the deaths, the health consequences, which is the diseases which are being caused, it has brought so much more meaning to what we actually do in municipalities." So ultimately, I believe that the biggest cure, if I can say cure for air pollution, is information, is communication, which is why it's so important. Even this podcast, which you're doing now, wider dissemination of information is critically, vitally important for people to understand that air pollution is what happens with us every day, every second. I mean, we eat 3 times a day, we drink water 5, 6 times a day, but we breathe 16 times per minute. So the environment, especially the air, is something we're so intimately connected with that it is crazy to think that it does not influence us. Of course, it influences us, and it influences every organ in our body, without exception, from the skin inwards, from the bones outwards. Every part of our body is influenced by the environment we live in, specifically the air, because air is probably involved in 2/3 to 3/4 of the health effects of pollution. It's much more important, for example, than eating polluted food. It's much more evident when you eat polluted food, but it's so much more important to think that breathing polluted air is a much more significant health risk because it impacts all the people, while eating polluted food is several people around a specific cluster. Breathing polluted air impacts all of a nation, all of the cities which are with high levels of pollution. So it's a topic which should be top of mind all the time,
Yeah,
especially, especially for medical professionals. Yeah.
that's very true. And I know you've also done some studies in Bulgarian cities looking at, what the impact of air pollution is on people visiting hospitals or the types of diseases they experience. Can you tell us a little bit more about what your research has helped you discover and how that's impacting what messaging you're sharing with people?
Actually, because of the relatively scarce resources that we have in the most eastern part of Europe, we did a study based on what we had. And what we have as a functioning system is the emergency health services, so the ambulance services in our capital city of Sofia. And because I know the people who are managing these services, I went to them and asked them, "Hey, can you give me the number of calls per day that you've received for the last 5 years?" And they gave me the number of calls per day. And from a second source, I had the actual air pollution on the same period of time. And I just matched one against the other. And it was really surprising that first we had a very strong correlation between the two. Something which I will say in statistical terms for those who are well versed in statistics, a significance of p-value of 0.77. That means that 77% of the differences in number of calls to the health services can be explained by the amount of pollution, because every increase in air pollution above WHO standards led to a 10% or more increase in the number of calls to emergency services. And people call emergency services when they have high blood pressure, when they have arrhythmia, when they get a stroke, when they have wheezing, when they have an asthma attack. All of these things are being caused especially in the most vulnerable part of the population, which is why when we have increases in air pollution, we immediately get an increase in the number of calls to emergency health services. And after the emergency health services come on board, these people are transferred to hospitals. So the number of hospital days, which were accounted for by air pollution, there was also a relative increase of between 6 and 8%. Only the difference was that they were with an offset of a day or two after the emergency health services. So the effect we saw was later than the actual pollution days. So when you have high pollution, on the same day, you get more emergency calls, and a day or two after that, you get more hospitalizations.
Yeah, that, I mean, I think, often we hear about and talk about air pollution in terms of how many people died as a result of it. But this is such a powerful way to talk to people on, something that maybe they will connect with better, because we've all had family members who've had emergencies like that. And, we also tend to just focus on the moment, not what might have caused it. And I think data like these can be really, really helpful. And even broadly, I think, as you've spoken about it today and in many other platforms before this, you're such a great example of how the healthcare sector professionals are engaging in air pollution. I think we need a very broad coalition of people. It's not going to be just the scientists. It's not going to be just the policymakers or a single body of people. We need everyone. But you've done this for a few years now in Bulgaria, and I know you also engage with groups outside Bulgaria and across Europe. Have you noticed any shifts in how the medical community, the healthcare community thinks about air pollution or considers air pollution as a factor, both in Bulgaria or across the region, across Europe?
Yeah, I've seen that slight shift, because I haven't seen a major shift, but I've seen a slight shift in clinicians being engaged with the problem. Mainly it's the scientists who are talking about it. But what I have seen as a very positive signal is that several societies have included air pollution as a significant risk factor for their most frequent diseases. For example, the stroke associations around both Europe and the United States have included air pollution in their most recent guidelines as a significant risk factors. The American Heart Association, the European Cardiological Society also have included air pollution within the spectrum of their risk factors. And many people still think that air pollution only impacts the lung, which is quite the opposite. Actually, the lung evolved to either keep pollution out or deal with it. So the lung is the least affected organ in our body, if we think from that perspective. Although I'm a pulmonologist and I should be saying the lung is the most important, it is important, but the fact is that air pollution impacts organs which are behind the lung, which means organs which are supplied by blood, because once pollution gets into the bloodstream, it goes to the heart, it goes to the kidneys, it goes to the pancreas, it goes to every organ, including a specific organ which has a double fence towards protection, which is the brain. Actually, this is studies from people who are firemen and people who deal with smoke. So people working in forest fires and firemen, half an hour to 1 hour after being exposed to high levels of air pollution by inhaling smoke, many of these people actually have a consequence of having stroke. So they get a brain consequence of inhaling polluted air. Up to a quarter of strokes, 1/4 of all strokes, can be linked to increased levels and exposure of air pollution, or specifically high levels of air pollution, like inhaling indoor smoke or smoke related to fires.
Yeah, I think, this is such a great point because a lot of our conversations on air pollution, especially with the general public, maybe not the specialists, tend to be centered around this idea that if you breathe in air pollution, it will impact your lungs. And if you ask people walking down the street, what do you think is going to impact what will be the impact of air pollution on your body? They'll say, oh, maybe my lungs, maybe I'll cough more, or maybe asthma, breathing difficulties. But what you're saying is so true. It really is an exposure that is impacting many
Every,
organ systems in the body.
not
And
many organs, it's every organ in our body.
yeah, and we don't see it that way. Like you mentioned earlier, you get a glass of dirty water, you're going to see immediately the water is dirty and you will probably make the decision to not drink it. But the air is different. It's harder to get people to focus on what's in the air around us. But I think you've done it so well and so eloquently, and you have been a very passionate voice, but also a very reasoned voice on what we need to do and how we work towards getting clean air. You've been successful in bringing together a lot of different people from different parts of the society together in support of clean air and better health. And I'm curious what inspires you and what is giving you hope for the future, for the world and the legacy that you're hoping to leave behind for your grandchildren.
What inspires me is the people I work with. They're truly inspirational people. They're people with a cause. And when you see people with a cause around you, you get inspired by that. And also the actual impact of this problem. It's a very big problem. It's a universal global problem, and it requires a global solution. So being part of a global solution is something which is very motivating for me, because I see that when you get large groups of people thinking along the same lines and starting to work along the same lines, that really, really important things start changing. If we look back at, for example, cigarette smoking, it took almost 200 years for this effect to be understood, and for bans to be made, and for effective policies to be put in place. With air pollution, which is basically the same, so smoking is personal air pollution is more global air pollution. We need to act faster, which is why I'm trying to prepare as many physicians as possible by going towards universities and working with students. I truly believe that air pollution as a separate topic should be included in the medical curricula of universities around the globe, because it is a global problem. We need to pay much more attention to it, and it needs to be raised to the level of its actual healthcare impact, which is immense. No less than 25% of the healthcare consequences of the environment can be directly attributed to air, which has either particulate matter or gaseous pollutants in it.
Yeah, that, such a powerful point. Also, really critical to think about the next generation and, engaging people early and quickly so that they understand the scope of things. And I think we've seen it now in many instances, especially in climate conversations, that the youth is leading the way. They're showing us, I'm saying us, not sure if I should do that, but, essentially leading the path for us into this discussion. We have a question from one of our listeners, Chad, and thank you for joining, Chad. He is interested in understanding whether the issue of air pollution and the science on air pollution and health effects is become a polarizing issue, perhaps, or an issue that can be divisive for people. And if you have any ideas on how to deal with people that may be skeptical about this notion that air pollution is impacting, our body and impacting our health, would love to hear your thoughts on this.
Yeah, actually, it has not become politically polarized, mainly because it was quite evidence based. So politicians tend to be able to polarize a topic when it's not evidence based. When it's evidence based, it's more difficult to polarize. But irrespective of that, I believe that the polarization can only happen when you have a trade off between economy and health. So, in countries where economy is on the upswing, so they're relatively less well off countries, that becomes a politically polarizing discussion. In countries which have achieved the basic life support of healthcare, the topic becomes health. So it's different between countries, and the only reason it's been politically polarized is because people are trying to achieve political fame or political power, using health as a means to do that. If we think about the science, it is unequivocal that air pollution is a very significant risk factor for a multitude of diseases. I say it's in the guidelines of the major cardiovascular societies around the globe. And these societies are not political organizations, they're medical organizations. The WHO, the World Health Organization, has established guidelines for the levels of air pollution which are tolerable, relatively safe. That has not been a political decision for the level. The political decision is how quickly we implement these levels, and that has been the real discussion in Europe. Do we go quickly to that level by suppressing some of the economically viable parts of our economy currently, or can we do this in a more relaxed and rather tiered way, having a longer period to do that? That has been the political discussion. Air pollution has not been the political focus of the discussion, rather the activities we do to meet the goals.
No, it's rather reassuring to hear that people are listening and using the science to make decisions, and hopefully we can continue on this path. I think this has been a fascinating conversation, and I'm really I think going to keep this idea in my head that you mentioned earlier. We're not, we are basically renting the air and from our future generations. So it is really important that we at least leave it how we experienced it, if not better. Thank you so very much, Alex, for joining us today and for all of your amazing work. We wish you all the best for continuing work around clean air in Bulgaria and beyond, and really hoping that you can inspire healthcare professionals in other countries to do similar work in their individual countries, and we can all work towards that future with blue skies and good air for all. So thank you very, very much. And for all of you listening in, thanks a lot for joining us. We will see you next on Friday, April 5th, when Krista Hasenkopf will be joining us, and we'll talk about inequalities in air pollution in different parts of the world. If you also have ideas for topics that we should cover or guests that you would like to hear from, please get in touch with us. Thank you very much. And Alex, again, thanks a lot for taking the time today.
It's a privilege to be with you this evening. Thank you very much.
Thanks.